involved with RSN for nearly 15 years. Support from someone who's been there makes all the difference.
Hey David, what are you listening to?
Kidney Talk, an online radio podcast that talks about kidney disease and the prevention of it.
Oh, cool. Where can I find that?
Oh, you can download it on iHeartRadio, Google Play, and Apple Podcasts.
Oh, nice. I'll definitely have to download that.
Shout out to Renal Support Network, the annual Renal Support Network essay contest. I won the Renal Support Network contest last year, the Warrior, and we are all warriors. So thank you. Keep on doing all that you do, and be happy and healthy and keep the hope. Thank you, Renal Support Network. Woohoo!
As a kidney transplant recipient, I find that having an actual publication like Kidney Talk is an invaluable resource for any kidney warrior at any stage.
RSN keeps me informed of kidney advocacy issues so my voice can be heard.
I'm really looking forward to the prom this year and meeting people who are just like me. Dressing up is super fun and all the activities are amazing. Can't wait to see you there.
Hi, I've been participating in the Renal Support Network 30-minute fitness Zoom classes. Not only have I lost 15 pounds, but I can also strike a yoga pose like this.
When I created Renal Support Network back in 1993, I had no idea the impact that I would have among my peers. An illness is too demanding when you don't have hope, and peer support, education, and knowledge are crucial to our survival. We have a great week planned with some incredible speakers, great information for you to share, learn, so we can survive and thrive with this illness. It's imperative. So stay tuned. We're going to have a great event, and a shout out to our corporate mission partners for making this happen.
We're going to go ahead and introduce our next speaker, and it is Kathy Lester. And Kathy is going to tell us all about Medicare and Medicare Advantage. And she is a principal at Lester Health Law, and she focuses on the intersection of healthcare and public policy. She provides legal and strategic advice to MEDL, I'm interested to hear what that is, on legislative and regulatory matters involving Medicare and Medicaid coverage. And I'm going to have to read these off: reimbursement, quality, federal health care funding, health information technology, and medical and internet privacy. She also has expertise in HIPAA, which is a big thing, right? We don't want people sharing our information. And so with no further delay, please welcome Kathy Lester.
Thank you. It's really nice to be with you all today. It's very exciting to get to see and be with patients, and really you guys are the true heroes of this community. And great shout out to Lori, who does such a phenomenal job of keeping all of us very positive and connected, and trying to make sure that's what's happening at the federal government level is doing what you need to have done in order to get the care and the services that you need. And that's really what I wanted to talk a little about today. So I'm going to try to share my screen here. So today just wanted to go through and build on the work that I know you've seen from articles that Lori has put together and others about how you might want to think about this new benefit and new opportunity, and whether it's right for you. So the first piece is just giving you a quick overview of the Medicare, original Medicare plan. This is traditional Medicare, and just to make sure we sort of level set, then talk a little more about the variety of MA plans and what they can offer that's out there, and then really end this with what you might want to consider as a patient and walk you through some of the tools that are now online from the Medicare program to help you learn about the plans that are available to you, to compare them to original Medicare, and probably most importantly, to figure out whether your facilities and doctors and the folks that you count on to provide you with healthcare are part of those plans. So first, Medicare eligibility and services in the original Medicare program, right? This is mostly a program for folks 65 and older, but with the one really important exception, which is once a person's kidneys have failed, that you can qualify for the Medicare program if you need dialysis. There are still the requirements that you need to meet under the Social Security Act or railroad retirement benefits or being a government employee. But this is a much smoother transition into the Medicare program for those with kidney failure and unique to that disease state, right? Cancer, cardiac disease, other conditions do not allow for automatic qualification. You still have to apply with an application, and there's a 3-month waiting period between diagnosis and kidney failure that really stems from, I think, what is still a question of when do you move from having a kidney issue to actually having kidney failure, right? That is going to be permanent. So acute kidney injury or kidney failure to chronic, and that is simply a time definition these days in the law. So as you see here, coverage usually begins the first day of the 4th month after your diagnosis and generally your dialysis treatment if you've moved directly to dialysis. There is also a way to qualify for if you are admitted to the Medicare certified hospital for a kidney transplant or pre-transplant services. The costs of original Medicare are pretty straightforward. There are premiums and co-payments, and you can see from this slide that the Part B premium for this current year, which you have to pay on an annual basis, is $144.60. If you're enrolled in the Part D as in dog program, that's the prescription drug program, which is separate and apart from the hospital program, which is Part A, Part B, which is the dialysis treatments and your physicians. Part D, as in dog, is the prescriptions, and that's about $32.74. The annual deductible is $198, and there's a 20% copay. So the services that are provided here are, again, most of you are very familiar with these, right? The dialysis, the physicians, transplant, immunosuppressive drugs for a limited time, but I am happy to report that there's a lot of good movement in the Congress this year, and maybe before the end of the year we will see an expansion of that benefit to make sure that there is permanent access to those drugs even after transplant through the Medicare program. Hospitalization, some oral medications if you sign up for the Part D program, hospice, and clinical trials. So pretty much I think what you all probably expect. But why Medicare Advantage is different and why it was so important, I think, to make sure that dialysis patients had the opportunity to enroll if it is the right benefit for you is because Medicare Advantage programs can actually provide you with additional services. This is sort of an all-in-one alternative to the Medicare program, right? At the outset, even if you don't want any services beyond what the Medicare, original Medicare offers, you have to enroll in Part A for your hospitalizations, Part B for your physician and dialysis services, and Part D for your oral drugs. In MA, it's a single enrollment. So you may have a lower out-of-pocket cost because of that, but you may also be restricted in the doctors or the facilities that you are allowed to receive services from. These are called the in-network facilities or providers. And you may need referrals for certain services that under fee-for-service would not require that extra step. But they may offer extra benefits, which I'll come back to in a moment, because some of those can be very important, especially for folks who are really looking for a transplant. You do not, however, need Medigap. And this is something that I know Lori has worked on for many, many, many years with us, is that not all states offer Medigap coverage for individuals who qualify for Medicare because of their end-stage renal disease status. And so not having to have that wraparound to help with the co-payment and other co-insurance requirements can be very, very helpful. There are different types of MA plans, much more like the commercial market if you think about getting insurance through your workplace. There are HMOs, or health management organizations, or maintenance organizations, sorry. There are PPOs, the preferred provider organizations, and those are different types of managed care, right? HMOs tend to be a little more managed than PPOs, so the networks tend to be a little bit tighter. They have more care coordination generally than a PPO, but both are a bit more managed than sort of a fee-for-service plan, which is more like traditional Medicare and how you interact with it. And then there are certain special needs plans, and there are some specific to ESRD as well, that really focus on caring for a specific type of patient. And what's an advantage about those plans is that they can really center in on what ESRD patients need, what additional services are appropriate. And so those are really tailored more to treating those chronic conditions than you might see in a broader plan. The great news is that open enrollment is going on right now for January 2021. So it opened in October and it closes December 7th. And what that means is this is your time to make that selection and figure out, if you are not already in an MA plan, if you'd like to be in one, what those options are. And this is important because this is the first year that the congressional decision to expand MA plans for Medicare beneficiaries who qualify because of ESRD and not because of age can actually enroll in MA. It used to be limited only to those patients who were previously Medicare beneficiaries because of age and developed kidney failure while in a Medicare Advantage program. So how are these two types of plans different? Medicare Advantage plans are required to cover all of the services that are in original. So you don't lose any of those services, with 3 exceptions. And then these sort of wrap around as Medicare services in addition to your MA plan. So that's hospice. There are sometimes new services that don't get captured in the MA plans when they first come online, and so those would remain in the original Medicare program for you to receive. And then clinical research studies, those remain again in that original Medicare. So if you're looking for services in those areas, the MA plan doesn't necessarily provide them, but you would access them through original Medicare. So I talked about the services that may be add-ons to what you are already receiving in original Medicare. Probably the most important one that I hear about when talking with dialysis patients are dental services. And that, you know, many of you know, having no cavities, having no infections are so very, very important in order to get on a transplant wait list. So the fact that Medicare, original Medicare, doesn't cover this can be a real barrier to getting to transplant. And so for some patients, MA plans have solved that gap. There are also vision and hearing services, wellness programs, which are not just medical services. You see here I listed the example of gym memberships, but they can vary in a lot of ways, and they don't have to be tied to a doctor or a healthcare professional. So there may be some activities that are wellness activities that may be covered by an MA plan that would not be part of original Medicare. Transportation for doctors' benefit or visits. This is really important, I know, for many patients, especially dialysis patients. You know, we just had one of the government advisory committee meetings this week, and every commissioner, most of whom are not patients, but one whose mother was on dialysis for 10 years, all talked about the difficulties that patients have, and one of the commissioners specifically about his mother, of how exhausting dialysis can be and how important travel and distance times being minimized are. And so MA plans can help with that if it's difficult to get to a treatment by providing some of those transportation offices. Over-the-counter drugs are included, which are not in Medicare. So this would be something that you wouldn't go to the pharmacy to get, right? It might be vitamins or other things that you're buying off the shelf. And adult daycare services. So, sometimes people need respite care. Sometimes it's just nice to, have some other opportunities, especially if it's a difficult time in the disease, and be able to have a place to go for the day where you can use those services. And those are included in some of the MA plans. It is also possible, as I said earlier, that some of these plans will tailor to services to patients with chronic diseases. So there are these ESRD chronic skill special needs plans that really do make sure they try to have things like dental, adult daycare, over-the-counter drugs, some wellness programs that are specific to ESRD patients, and really sort of cater to those services, so you're getting everything that you need there. I'm going to show this slide, and then I'm going to show another slide at the end, which is very similar. But I wanted to kind of have you keep in mind, before we look at how you can use some of the tools today, what should patients ask? To me, they fall into 3 areas: accessing your healthcare, your doctors and facilities, and what are the costs that you're going to have to incur. So in that first bucket, you really want to know what services are being provided. Because you end up having to work in network, meaning there are certain providers that are preferred, and they can have lower costs if you use them, and you don't necessarily have to have referrals. You do want to know what the services are. So if those restrictions of the networks are a little having you change certain providers or facilities that you visit, you understand that may be because there are more services offered. So this is a really important question to be able to compare. It's also important that those services you look at are ones you need and you want to benefit from. What dental services are available? Again, it's important. It's not just looking at do they do dental services or not, but really are they aligned with the services that you would use and need. So for example, I may have a once a year cleaning that I would want to have covered, or twice a year checkups, but that's not covered. What's covered are emergency dental services. So you need to understand where those services are. And then look at the services and see if they're actually useful to you. Drug coverage is important. And in a lot of plans, you can look and see if they cover your drugs, recognizing the number of drugs that patients with ESRD, kidney failure have, are enormous, and that certain drugs work better, and especially transplant patients, right? There are very specific medications that you and your doctor figure out work best for you, and you want to make sure that you can get those. So checking out and making sure those drugs are covered in the plan is an important step. And then also ask about care coordination. Think about whether or not the doctors are really talking to each other. One of the advantages of an in-network is that they should be able to talk to each other, that is encouraged, that they are rewarded by the plan for doing it. And as we all know, when your doctors talk to each other, you probably get better care at the end of the day than when they remain in silos. So knowing those questions help you understand what access to healthcare you're going to have. Of course, equally important is the number one question: will your doctor or facility be in network or out? This is going to get more complicated over the next few years. I think right now, as we're looking at it, very few contracts and facilities changed between 2020 and what you're seeing in open enrollment for 2021. But the Medicare program changed the rules, and this is something that we've been fighting at the federal level to reinstate. And there's something called network adequacy standards, right? That the government does require these plans to have a minimum number of providers and facilities in their plans in order to have an adequate network that provides access to patients. Outpatient dialysis was always included in those network adequacy standards until this fall, when CMS removed it. What that means is, prior to this, plans had to make sure that there were dialysis facilities within a certain time and distance. of the beneficiary, as well as a minimum number of providers. This is not just the facilities, right? Your physicians, the specialists that you see, and that protected the access. And you could open up some of the websites that I'll show you in a minute and see your list of providers. Because they are not on that list, or there's the outpatient dialysis has been taken away from the network adequacy requirement. Some of those providers or facilities may no longer appear on the list because the plan now only has to attest that the patient will have access to a dialysis facility, to nephrologist or the specialist, but they don't have to necessarily be in the network. And they can do that through an attestation, a piece of paper that they sign saying, yes, we have a sufficient network. So we're a little concerned that while most plans will do the right thing and keep providers and networks, there are some that may not. And so you should be very focused on making sure that if it's not clear, asking those plans, because it is their obligation still under federal law to give you access to your facility, to your physicians. And so you want to make sure that that is settled before you ever sign up for a plan. And if there are plans that look like they are not doing that, it's important to let the federal government know so that can be corrected. You also want to look at your pharmacy. Are they in network or not? So you don't have to go around changing where you receive your medications. Do you have to drive further? Again, not just thinking about the dialysis facility, but the specialist. Maybe there are closer specialists that you would like to use, and that those folks would be on a list that you could see. And also, do you have to have referrals, and when do you have to have referrals? Some plans may have a lot of referral requirements, some do not. And a referral, as you'll recall, is one of your primary physicians writing a prescription or writing an order indicating that you do need to go and see this other physician. Without that referral note, oftentimes the plan will not recognize the visit and make you pay either out of pocket for it or as if it were an out-of-network visit. And so those have higher costs. Which brings me to the last thing to really want to keep in mind, or what are the costs? So what are the out-of-pocket costs? There are caps on out-of-pocket costs. And for 2020, those caps on MA plans were north of $7,000. That was the most you could pay out of pocket. And I bet a lot of you are thinking, wow, compared to original Medicare, that's a good deal. And it can be. And it is one of those reasons why many patients come into the MA program. That said, many of these plans do still require a 20% copay. So you want to look at the plans and their cost sharing obligations and understand those. You also want to know what you have to pay. Like I said, if you're in network, it can be a much lower amount than if you are out of network, and understanding where your providers are and the facilities that you want to visit, including hospitals, you are very important in your decision making. So let me talk about how you might go about finding out some of this information. So the next slide is a screenshot, and I have the link here, and we can definitely get it out to you, but it's medicare.gov. And for anyone enrolled in Medicare who's given Medicare their email address, you have probably seen link after link to the site since October 15th. And what it does is help you in an automated way look at the plans that are in your area. And so this screen gives you a choice. Are you new to Medicare, or are you in a special enrollment period? And you can select one of those, or if you already have engaged with the system previously, you can log in again as yourself. So once you come into the system, it will ask you or share with you what your options are. Original Medicare, as you can see there, or Medicare Advantage plan. You can click on whichever button you want to start with and be on your way to learning more about it. So let's start with Medicare, Original Medicare. And I know this is a little small, but it's a screenshot of what you would see if you linked in to the website. You can see there the green checks show you what is covered in Original Medicare. You can see that drugs and help with out-of-pocket costs have X's next to those. Well, drugs you could add on if you clicked one of the boxes at the top that you see there that says add a drug plan, and it's part D. You could also get help with out-of-pocket costs by adding a supplemental plan, which is a Medigap plan. And again, that's a box that you can check at the top, and your results will begin to show whether you have access to a Medigap plan and what options you might have for a Medicare Part D plan. This is a good time to pause for a second and let you know that Medicare Part D plans are more like Medicare Advantage plans in that it is not a single option offered by the federal government, but rather private insurers can offer different Part D plans. And for those of you familiar, you've probably been on the websites that are just like this, and you can see the whole list of plans in your areas. You can put in the drugs that you want to use and see what the cost sharing would be for them. So it's a really nice decision tool to help you figure out which Part D plan would be right for you. Finally, the last box that is not checked there, the vision, the hearing, the dental, and more, that's what you would need to go to a Medicare Advantage plan for. But as you can see here, you get a taste of what is available. You can click some of these other boxes. In the green box on the side, you can see what the premiums are. And you can also see some additional information about the Part D plans. Once you, if you want to move forward from this stage and looking at this, you can click some of the other buttons in terms of continue and go through the process of enrolling. You can also switch over to the MA plan, and you see that box at the top. So let's do that here. Again, you can see that the boxes of adding a supplement or Part D are grayed out because you don't need those in this plan. Those would be included in what the MA plan offers. And as you can see here, all those coverage includes have green checks except for the one use any doctor or hospital that takes Medicare across the United States. And that is because as we look at this, remember, they have networks. And so this is where doing some additional research before you sign up is important because they will limit the doctors that you can see. But as I said, they're supposed to meet network adequacy requirements. And so looking to see that your facility and your physicians, your specialists, and your pharmacy are in network is very important. You can see over here in this first screen, right, where they give you some range numbers for your zip code. This range is for my zip code in Northern Virginia, and it shows you what my premium would be based on that zip code. But I can then go in and hit this continue button and then begin to see the different plans that are available to me. So here's an example of how the plans are beginning to be described. And I'm not going to go through a whole bunch of these, but I thought this was a last screenshot that might be useful. So this is on the prescription drug plan side. You can see here that they show me a rating. The star rating is a quality rating that the Medicare program puts out. You can go to a website and learn about what types of metrics are used to evaluate those stars. They are not patient satisfaction numbers. Probably a presentation for another day, but we've worked really hard and still have a lot of concerns about the star rating program in the Kidney Care Partners community for ESRD facilities, because there are some problems with the metrics and how the information is rolled up. But it is an input that it can be useful to look at. It also shows you here the monthly premium specific to this plan, the deductibles, the yearly drug and premium costs. And again, you can do this with the health plans, the MA plans as well, and move through some of the different options, go in and look what providers are available in that network before you sign up. So before I open it up to take questions that folks had, I wanted to put a little slide in about referring to an article that Lori wrote about, how do you decide? And I thought the questions that she had here were really very helpful, and I wanted to sort of leave those up for you to see. And I think she can put the link in the chat and get that out to you. But you can see it's about where are your doctors, what are your out-of-pocket costs, what it would mean if your hospital or your transplant center is included, what those benefits are, how far you have to go and travel. Are there any travel benefits that might make it easier to get to doctor's appointments or facilities? What is going on with drugs in terms of what is covered, where your pharmacies are? And then one piece that we didn't talk about too much, but those, the quality of the program. The MA programs, in addition to your facilities, can be rated through a star rating. The MA star rating program has been a little less controversial than the one on the dialysis facility side. And so I would encourage you not only to look at the stars, but to really dig in a little deeper there and look at the underlying measures, because everything being rolled up has different weights. They're given different values. And what may be important to the federal government may not really be important to you at the end of the day, that you might want to think, for example, about anemia management, or maybe how the plan fares in engaging in customer service. Dig into those quality metrics, which you can do via the Medicare website, and they will show you metric by metric, what information they gathered to put together that 1-star rating. But you can learn a little more about it. And really the other question is, what, if any, time you might need to hold on re-enrolling in Medicare Advantage or in original Medicare if you become unhappy with your MA plan. And again, this can vary by patient to patient, and you really want to look at what that timeline is and if there are any sort of restrictions, because certainly you want to make sure, given the number of times you have to see a physician, the number of times that you are in a dialysis facility, that you have the right access to those doctors. So I am going to open it up to questions. I know I see some that are in the chat, if I can open them up here. And let me just ask my great host if I should go read through these, or how do you want to proceed?
How about in the Q&A, I'll read those, and then if you see any that I missed, you can address them. I actually have a question myself, but I'm going to put myself at the end. And so the first question is from Vicki, and Vicki wants to know, will Part D cover post-treatment medications?
So that's a great question. And I think what happens, kind of depends on where you are in your Medicare enrollment. So if you are over 65 and you're in Medicare because of age, you are going to be able to maintain that Medicare coverage post-transplant. If you, however, are in there because of the diagnoses, and I may be answering a slightly different question here. You will at one point come off of Medicare because you will no longer have kidney failure, have a functioning kidney, a functioning graft. And so that is where we're working on the immunosuppressive bill to make sure you continue that coverage at least. If you're looking at post-dialysis treatment medications, it depends on plan by plan. So you'd want to look at your treatment medications. Many of those will be covered, but each of these plans has a formulary. And so sometimes the branded drug is on that formulary, sometimes the generic, and those formularies can also have different tiers. So one product may be covered in a less expensive tier, lower copay amount, for example, and other drugs may be there, but in a higher tier. So you do want to use those plan finders that allow you to enter your medication name and see where it comes up in those Part D formularies.
Okay, thank you very much.
Sure.
The next question is from Wesley Stewart, who I have the privilege of knowing. And he has asked, I have aged into Medicare this year. I chose a Medicare supplement plan because I'm afraid that my providers might not be on any Medicare Advantage plan. Perhaps some states do not have PPO MA plans. Also, when COVID subsides, I want to be covered when I travel. Do you have any advice for Wesley?
Sure. And I think if you can get a supplemental plan, it is, and you're in original Medicare, absolutely do that. The out-of-pocket cost can be extraordinary. And I know for my own grandmother and my mother, you know, those supplemental plans were essential to allowing them to continue to receive services and not, you know, have an enormous financial burden. So I'm glad you were able to do that. I do think it's a legitimate fear about providers not being in the MA networks. There are some plans that are very good. And there are some plans dedicated, as I said, to ESRD patient populations. And I do think they work very hard to make sure their networks work. But we also know of many examples where either out front, they're very clear that they do not want to have certain providers in their network, and they make it very difficult for them to negotiate rates. Or they somewhat hide some of those issues where you have to read the fine print. And what you find in the fine print is that you're not really getting anything different in terms of financial cost savings or services than you would in original Medicare, and they have now limited your providers. So I do think before anyone signs up for an MA plan, you really want to make sure that your facility, your doctor, and as Lori noted, your hospital, or if you're looking at a transplant, what your transplant hospital would be. They do change the list of network providers and facilities on an annual basis. They do it through contracting. It doesn't necessarily change a lot from year to year, but you always want to check because, as you know, negotiations can lead to different results. And with the changes in the rules this year, you know, while I don't necessarily expect a lot of big changes in the networks for 2021, because the changes in the rule happened midway through the contracting process, that's a big issue for 2022, and something I know we're monitoring at the national level, but it's important for you all as well. And you're right, some states do not have PPO MA plans. State laws regulate what type of plans can be in their state. And while most states do allow PPOs, not all do. And not all plan sort of organized, you know, the big plans offer every type of plan in every state. So Aetna, for example, might offer a plan in Indiana, but not in California, or vice versa. So you really do have to make sure that those are available. And I think you're asking too about coverage. You know, when you travel, you know, I defer a little to Lori on that. I think she may know a bit more, but my understanding is, you know, that under original Medicare, you should be able to arrange a dialysis session or whatever you would need in travel through your organization, your dialysis organization. And if you're, you know, in an organization that is not a national organization, I think it's working with them to identify a facility where you can dialyze. I do know that, you know, they are pretty good about making sure, you know, you don't miss a treatment when you are traveling. And I think we're all looking for that post-COVID world where we can get out of our houses again. I know I certainly am, and getting my kids back in school.
Okay, so it looks like we're getting more and more questions. I'll ask two more, and then Kathy, if you wouldn't mind looking at the Q&A, maybe you could answer some so we can advance to the next speaker.
Absolutely.
So why don't we ask one more question, and then if you'll follow up on the Q&A, that'd be awesome. I know everybody would appreciate it. Paula Siegel wants to know if I have a 10K out of pocket and dialysis is covered at 80%, does that mean I'm on the hook for 10K since my out of pocket will be reached during the year paying the 20%? Or is there any other supplements or help from the government to cover the $10,000 if one is not eligible for Medicaid?
Right. So I'm going to guess for the moment that this is a question about original Medicare because of the 80-20 split. And so if you are in original Medicare, your best option for trying to cover the out-of-pocket expenses, and I'll get to the $10,000 in a moment, is that you have a supplemental plan, right? I know not all states offer it, and there are some states who do offer it if you're under 65 but qualified because of dialysis, that don't actually give as rich a benefit as some of the other Medigap policies. And again, I would say, you know, a Medigap policy is something that you can adopt as you look at it. I remember adopting this again, helping my parents do that. I think there were plans A through J. This would have been in the early 90s when I did this with them. And so that may have changed a little, but you know, you want to look at all of the benefits they offer or not, because it is an additional, you know, premium that you have to pay to have that, but it does then pay a certain part of your out-of-pocket expenses. For example, with my grandmother, she had a plan she put together in the 80s, and it paid 100% of her coinsurance amount. It was phenomenal. It was totally worth that money. Others may not be that generous, but you do want to look and select. So again, I'm going to interpret here a little. If your true out-of-pocket maximum is $10,000, you have to spend up to that $10,000 before your copayment or coinsurance obligations are eliminated. But if you are doing that through Medigap, again, you have to look at plan by plan, but in most cases, the Medigap policy can count toward that out-of-pocket expense. And I know this is a real challenge because as you noted here, Medicaid can help with that. But to be honest, in a lot of states, what Medicaid does is it simply eliminates the obligation for you. It does not actually, in the end, pay the 20% or other coinsurance obligations to the providers, but it eliminates your obligation to do that. So a little different than a Medigap plan, where the doctors or the specialists you're working with would get that 20%. So hopefully I guessed right on the end.
Well, she actually said no, it was for regular Medicare. However, out of courtesy for our next speaker, if you could maybe address that in the Q&A to her post, and then everyone else. Obviously, this is something that a lot of people have questions about, and honestly, it's something that affects a lot of our lives. And so I understand why all the questions are there. And even myself, I work in dentistry. You know, I had questions as well because of the ability of dental offices to work with Medicare on who's accepting and who isn't accepting. But Kathy, thank you very much for your expertise. I look forward to seeing your comments in the Q&A, and I'm going to go ahead and introduce our next speaker. And
thank you all.
Thank you. Thank you. We really appreciate it.
And a shout out to our corporate mission partners for making this happen.